With that, I'm going to invite Liane Ventura to talk more about her research within this next segment, which is the Node Talk. So, Liane, if you wanted to briefly introduce your topic and take it from here, that would be great. Thank you.
Thank you. Hello. As I mentioned, my name is Liane Ventura, and I work at CARE Women's Health, which is in the College of Public Health at East Tennessee State University. And the study that I'll present today is called Contraceptive Access at Federally Qualified Health Centers during the South Carolina Choose Well Initiative, a qualitative analysis of staff perceptions and experiences. It was published in Women's Health Reports in 2021. So the background for this study hinges on reproductive autonomy and the importance for women to have access to the full range of contraceptive method options. However, many methods due to policies are not widely available, and a lot of methods, such as intrauterine devices or IUDs and implants, are often cost prohibitive. And so federally qualified health centers are subsidized, federally government funded clinics to provide primary healthcare services to low income and uninsured patient populations. And these clinics are an important point of access to healthcare for many people. But some FQHCs receive Title X funding, which is to support contraceptive care service provision. And not all Title X funds are distributed to FQHCs because this is a state level decision. So this brings us to South Carolina, where FQHC clinics do not receive part of the state's Title X funds. And in 2017 in South Carolina, the Choose Well Contraceptive Access Initiative was launched. This is a 6-year multi-sectoral initiative that was aimed at increasing access to the full range of contraceptive method options and reducing unintended pregnancy rates within the state. So the objectives of this study were to assess changes in contraceptive access associated with the Choose Well initiative among FQHC clinics within just the first 2 years of the initiative. Also to identify facilitators and barriers to the provision of IUDs and implants, and finally to identify perceptions of sustainability. So to achieve these aims, we conducted semi-structured key informant interviews with clinical and administrative staff at Choose Well participating FQHCs in South Carolina. And the study took place in 2018 and 2019 with a total of 34 individuals participating across both years. And the interviews were transcribed and coded using a validated inductive coding process. To analyze the data, we applied the A's of Access framework, which indicates that access is comprised of multiple dimensions. And we specifically looked at the availability dimension of access, which refers to components of supply and demand. So regarding key findings, we found that perceptions of the impact of Choose Well on supply and provision of IUDs and implants were highly positive. Of note, facilitators to access included the ability of clinics to provide same-day placement procedures and also increased capacity for contraceptive counseling. Provider factors were noted as a barrier, such as not every provider being willing or comfortable to provide these kinds of methods. In addition to clinical components, administrative factors were noted to have increased access to IUDs and implants. So billing and coding practice, enhanced clinic infrastructure and workflow, as well as expanded staffing capacity and buy-in among staff were helpful to increasing access. Finally, in thinking about sustainability, respondents emphasized various facilitators and challenges to sustainability. Facilitators were 340B drug pricing program, patients enrolling in Medicaid, and continued staff training for specifically contraceptive counseling and device placement. Challenges to sustainability include high cost of contraceptive devices and the high rate of uninsured patients. Next slide, please. So funding for provision of enhanced services, health insurance, and continued and expanded training opportunities were some emergent themes within the sustainability concept. And I've noted within that specifically 340B drug pricing program, patients enrolling in Medicaid and continued training were all noted facilitators. So while this study examines the perceptions of the impact of Choose Well among FQHC clinics, the initiative is multi-sectoral, and there are other types of healthcare access points to examine. And so at the SBM annual meeting, our team will be disseminating findings on perceptions of the impact of Choose Well among Title X clinics in the state, as well as labor and delivery hospitals. So thank you so much for your time. I really appreciate this opportunity to share our work in South Carolina, and please let me know if you have any questions.
So we do have a question. Laura, if you wanted to.
Yeah. Oh, thank you so much. Thank you so much for the talk. I love learning about new things that I hadn't heard about, so I didn't know about this initiative. One thing that, and I apologize if you maybe said that and I wasn't paying attention when you said about that the positive effects it had on other sort of administrative aspects like workflow. And so can you elaborate a little bit on why that was? What was the positive effect? How did that come about through the initiative?
So this work actually built on some prior work that we did around the A's of access. And we found that when examining clinical policies and procedures within the supply and demand component of access, that there were clinical features that were involved with supply and demand as well as administrative factors. And so we saw that emerge from the qualitative data where respondents noted that these administrative components helped to facilitate clinical service provision or the availability of services. In regard to the initiative, we saw that specific aspects of the initiative were integral facilitators. For example, they provided training to clinic staff for improved billing and coding practices and training for workflow improvement. And so these specific facilitators were linked to the intervention.
That makes a lot of sense. Thank you. Yeah.
Thank you, Liane. And I think would the results look any different now with the change in policies, or is that something you're going to look at more when you are going to present at the annual meeting? I'm guessing that's going to be more.
So we'll be presenting more in-depth mixed method analysis at the annual meeting, specifically around how the initiative has impacted access at Title X facilities. And we'll be doing in this upcoming year a deep dive into how the initiative has impacted FQHCs specifically in the later years of the initiative, because what we found is that this was a very prominent sector that was impacted by the Choose Well program. And so we'll be focusing on FQHCs in future years. And so there will be a follow-up to this particular study.
That sounds good. Thank you. Are there
Thank
other
you.
questions at this time for Liane?